Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level.
Hi guys, and welcome to the Veterinary Rehabilitation Podcast. Today we are sharing with you our very first Vet Rehab Summit prelim, where we are interviewing and chatting to and getting to know the amazing companies and lecturers that will be joining us at the Vet Rehab Summit on the 8th of November. Now, in today's podcast, I'm sharing an interview with Narda Robin with you, and I had so much fun in this chat, you guys. So I think that you're going to have just as much fun listening to us talking. We spoke about evidence-based medicine or evidence-based rehabilitation. We went down a couple of rabbit holes, so I'm excited to take you along for the ride. But before we head into that interview, I want to say a big thank you to Paw Prosper. They are our podcast sponsors, and thanks to them, you can listen to this podcast today. So Paw Prosper is pretty cool. They believe that true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Their brands are trusted by veterinarians, universities, and rehabilitation facilities. So whether you're looking to train, rehab, or help your patients age gracefully, brands like Walking Pets, Help Them Up, Respond Animal Therapeutics, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts, they all fall under Paw Prosper. These brands offer effective, innovative, and proven solutions. If you sign up today, you will receive a one-time special gift just for our Online Pet Health listeners. You can sign up at the link pawprosper.com/OPH. And with that, guys, over to our interview. I hope you have a blast. Hi guys, and welcome. I am so excited to be here today with Narda Robin, and we are kicking off the Vet Rehab Summit prelims. If you don't know what the prelims are, basically we are meeting the sponsors and lecturers that we are most excited. That's a terrible way to put it because we're so excited for all of them, but okay, the most excited to see and learn from and connect with at the Vet Rehab Summit on the 8th of November. So Narda Robinson is from CuraCore, and she is our silver sponsor this year. You were with, how many years have you been with us at the Vet Rehab Summit now, Narda?
What is it, 4 or 5, or I don't know, long time.
Yeah, I think so. I was going through them all today, all our sponsors again today, and it's just the same companies always come back, and I love that because we've really built an awesome relationship with the companies that help our community the most. So I really love that. So guys, if you are tuning in with us today, we're doing things a little bit differently from our usual Facebook Live setup. To get to know Narda a bit better, I'm not going to let her introduce herself. I'm going to ask her a few fun questions. So, Narda, are you ready?
I am ready.
Awesome. Okay, first of all, if CuraCore were an animal, what would it be and why?
It would be a cat. Mainly because, we're a bunch of cat people. A lot of us are. And, we're not in your face. We don't lick your face or anything, but we do our thing quietly and well.
I love that. Cats are so awesome, and they have such a range of very interesting personalities. I love that. Mm-hmm. Okay. What is one thing that most people don't know about CuraCore?
One thing is that we are now opening up in Canada on Vancouver Island, and that's why my internet is a little bit it's a lot less than Colorado where we've been for 30 years. But yeah, we're adding courses in Canada starting in 2026. So that's new information.
Oh, that is exciting. New location.
Mhm.
Has everything has moved to Canada?
No, we'll still have a presence in Colorado as well. But yeah, we're in on Vancouver Island again. As I said, the internet isn't as good, but so I apologize if I freeze. But the country is vastly beautiful, and I am right next to the ocean.
Okay. Oh, that is amazing. Okay,
Hmm.
that's worth the big move. I love it. All right.
Yeah,
I'm going to ask you some rapid fire questions, Narda, and you
super.
need to just select the one that appeals to you most off the bat. Okay. Are you
Go.
ready?
I'm ready.
Tea or coffee?
Tea.
Cats or dogs?
Cats.
Are you an early bird or a night owl?
Early.
Early. Okay, I like it. Thank you so much for playing along. That was really fun.
Oh, good. I got 100%.
You got 100% marks. Awesome. Guys, if you're tuning in with us live, it is so good to have you. Welcome to the very first of the Vet Rehab Summit prelims, where we are getting warmed up for the summit. Whoop, whoop. Okay. So we are chatting about why evidence-based matters in vet rehab and what we still don't know in our profession, in the research. So, Nada, why is an evidence-based approach so important for us as a profession?
Well, it's important for veterinary practice and just animal practice anyways, as with humans. I mean, it's not that we shouldn't do things that don't have a strong, double blind or whatever research basis, but we have to just recognize across the board where the evidence is, so what we more solidly know and what we don't. And again, this applies to surgery as well, which for the record doesn't have any double blind controlled studies because you don't do surgery blind. And I say that because coming from teaching, medical acupuncture and massage and laser therapy and botanical and all that for this long, I mean, it's a common criticism that the mainstream surgery and drugs, those kind of approaches, that people that promote that and discount rehab or integrative medicine, it's a common criticism that they will lob to, the non, straight mainstream, but they tend to forget what they are lacking themselves. So there is that. But I think particularly because rehab is such a relatively new field, it's easy to get convinced that, all this stuff is proven and strong and they're all equally supported or whatever. And what we really don't know, I mean, even things like shockwave, okay, there's some evidence, but there's a lot of unknowns about even how it works. And so chiropractic, people that know me know I have strong views about chiropractic for animals, but there are essentially no studies even on the safety of chiropractic for dogs or horses. And so by tuning into how much evidence there is and what it says, it helps us to be better practitioners.
I really like that. I think we forget that the model of double blind, clinical trials, prospective double blind clinical trials, that ideal model, it isn't actually viable for so much of what we do. And so when we're looking at the evidence that we do have, what does that methodology, how does that affect what we should be taking from it? I think that's so important to keep in mind. So yes, thank you for that one. So as you know, our theme this year is dynamic by design, and we're really focusing on movement-based therapy, because because you can tell us, because what does the current evidence tell us about exercise-based therapy in rehab, and where are the gaps?
Yeah, well, it's of course strongest for humans. So we extrapolate a lot of information from there. But with humans, I mean, movement is important for cognition, for anti-inflammatory potential, for just inspiring our own endogenous mechanisms for recovery. So that also gets us into an adjacent field of fascia, myofascia, and just how load bearing, stretching, healthful kinds of movement stimulate the body's own internal healing processes. Like, and with fibroblasts, especially within the fascia, that we're going to have production of growth factors and other biochemicals that help to knit together uh, the connective tissue or bone healing or whatever it is, so that I mean, we are, yeah, dynamic by design. We are meant to move. And so there's all the benefits, circulatory, the mental, emotional, everything strengthening from active movement. But there is also, in contrast, the detrimental effects of non-movement. And I think that is particularly important for animals, because we have dogs and cats that don't get enough exercise, that don't have opportunities to move, and stretch and jump, and of those percussive forces of jumping, hopefully not on somebody, but even stretching your iliopsoas as a dog jumping onto somebody. Yeah, we don't want that necessarily, but there is therapy in that movement, if we could train it in a good way. But horses, freedom of movement. So our Western or whatever, our global human society has so diminished animals' freedom of movement, that they suffer from that, and they have repetitive motion injuries. They have, obsessive compulsive disorders because they aren't moving.
Yeah, I really love that. So you've highlighted, I mean, for me, the cognitive portion of it really stands out. You said anxiety, compulsive behaviors, there's so much there, and it all can be affected and improved by movement. So yeah, I think it's really important that we realize how much we are restricting animals through our lifestyle, through our normal lifestyle. And then how do we get out of that, right? Because it isn't just going to be once a day runs that then predisposes, like you said, to repetitive strain injuries. So how do we increase the amount of movement but without increasing the risk of injury? I think that's one of the big questions that that hopefully we're going to get clarity on at the summit.
Yeah. Well, I think a lot of it depends on the human caregivers and educating them, and they could use more movement too. Yeah, I mean, it's part of just the design of society and cities or whatever it is, that there's these close encounters. So dog parks for dogs, that's one little step, but that's there's so much more. But then there are the things that we use, like just collars and leashes, and how that is yanking on the necks. And there's a lot more that information that we need to deliver to people and recognize ourselves. Like when we see that, like, oh no, that's accentuating the problem, let's have a discussion with the client.
Around that. Yeah, exactly.
Mm-hmm.
And what stood out for me now is that it's our lifestyle as well. So really to
Mm-hmm.
create change that's going to be beneficial for our patients, it's the entire household's lifestyle that should be addressed, and
Mm-hmm.
that should be shifted towards a more movement based space. So that's really interesting to think about. Yeah, it's always that whole dyad, the whole family that needs to come together to create change. So yes,
Yeah.
Narda, yeah, carry on.
Oh, well, I just, as you were talking, I was thinking too of in small animals, well, even probably large animals, but just even from the practitioner's standpoint, like you think of maybe these corporate practices or whatever, the practitioner walks into the room, sees the animal on a table, doesn't ever watch them move, and
Mm,
may not even touch them, and then come up with a diagnosis. And so, what I like to promote among my students is, let's watch that animal move as unencumbered as possible so that we can make a better determination of where they are restricted, where they might be painful and having protective, compensatory things. You have to watch them move, and they have to be relaxed in terms of doing that. So partnering with our patients, making a non-scary environment for them. So many changes have to take place. I should really have my own vet school and start from the beginning.
I agree. Yes, yeah. So many
Mhm.
things actually need to be integrated into the veterinarian's training from
Mhm.
much earlier phases. Yeah, that's a very good thought for us to ponder. How do we solve that problem? How do we help create more educated vets, more holistically potentially educated
Yeah.
vets, I should say, because their education is pretty deep and broad already. But
Mhm.
it's really specific, right? Yeah.
Yeah.
Okay, so let's shift a little bit back to our evidence-based topic. How does CuraCore support practitioners in bridging the gap between science and practice?
Well, just to present information that is factually based. So whether it's, medical acupuncture, herbs, the whole thing, that it's not just saying something and expecting people to believe it. It is coming up with the evidence. And again, thinking back to vet school, how many times should we have, raised our hand and say, okay, you're promoting this surgery, dare I say TPLO, and what's the evidence for its superiority, because it's being considered the gold standard without sufficient evidence, and it's not compared to integrative rehab. So, I really promote critical thinking from start to finish of all of these approaches, and using that as a means for the practitioner to decide, okay, so I have this finite level of time and client resources and all that. Well, how can I make the best decision, the best rehab protocol for the animals that I am trying to help? Because, I think one of the crazy making things about rehab education is that you have like 15 different modalities that you could choose from, and what makes the most sense. So by understanding the science and evidence of each modality, like, why would I use laser therapy for this when I could use shockwave, or I could do acupuncture, or I could do therapeutic exercise, or, underwater treadmill? So what are the mechanisms of action of this modality? What is the mechanism of disease or injury that this animal has? How do they best interface in the most thoughtful, effective, and efficient way, such as reducing inflammation, having neuroprotection, having, strengthening aspects, promoting circulation, normalizing inflammation, normalizing immune function. So without having to go into, qi and yin and yang and all that, by having a science approach to acupuncture, for example, yes, we can think of all the ways that this actually works scientifically. And I mean, it's one of the top modalities in rehab.
I really love that, because one of the things I come up against so often is that because I have a laser, I'm going to use a laser. But it isn't necessarily the most effective tool that you have in your toolbox. It's just the one you're most comfortable with, or you're using the most. And I'm using laser as an example, but this could apply to all modalities. Tense is actually a really good one, because I see us using it so often, and the context within which we use it isn't necessarily going to get us the best outcome for the amount of time that we're spending. And are we really critically thinking about why we're choosing that modality? So
Mm-hmm.
I would love more critical thinking in terms of comparing modalities, comparing
Yeah.
approaches. For this patient, what is going to be my most effective, most evidence-based approach? How am I going to shift that when I see the next patient? Really optimizing the time that we're spending with them, because
Mm-hmm.
we're choosing the most effective treatment options based on the science that we have. And the science that we have, we're approaching critically. We're not just reading it and going, yes, I should be doing this, that, and that because this paper had a positive outcome. No, that's not good enough. Right?
Right.
What why did they have a positive outcome? What was their methodology? What was the patient group? How big a patient group? There's so much that goes into that. So I think we need to put on our critical thinking caps a little bit more frequently. Yeah.
Yeah, and just to add that who is this patient? What do they need? What is my diagnosis? How did I arrive at that? Did I include movement analysis, myofascial palpation, the full spectrum of what that animal has? And their emotional state, what will they do best at? So when we advocate creation of rehab protocols, the patient and the client's goals also means front and those are frontline considerations. And then it's like, okay, let's try this, but let's not just stay stuck in that routine. So it helps to have community too, like you have, that we always are stimulating each other and keeping in mind, oh, okay, yeah, I forgot about that, let's integrate that.
Yeah, having a safe space to ask
Mm-hmm.
questions or question your beliefs, I think is so important. You should be
Yeah.
able to say, I wonder if I'm doing the right thing here. What do you guys think? And then have a safe community that's going to come back to you and be able to brainstorm. I think that's where our mentorship programs are really
Mm-hmm.
useful,
Mm-hmm.
because they're much more personal. You're one-on-one with a person or in a small group. But the Facebook communities as well, I've seen them
Mm-hmm.
really shine in this area, just because
Right.
we are here to be, first of all, supportive as a community, and then secondly, to raise each other up. Let's
Yeah.
get better. All of us together, let's keep pushing the boundaries and getting better all the time. So I really like that. Thanks, Nada.
Oh yeah,
Um,
and that's what I love about online pet health. I mean, you have created this global community and of sharing and mutual support. It's really important.
Thank
You're welcome.
Okay, so Nada, what excites you the most about where evidence-based integrative rehabilitation is heading at the moment?
Well, it's wildly popular, and clients are asking for it. More and more veterinarians and technicians and physical therapists are interested in it, and we're just expanding. Like I am in Canada, because there's no Canadian company that is offering this to Canadians, and I just think it's the ethical thing to do to be able to offer clients and patients more options than just surgery and drugs, and to do that in a very careful, considerate way, but to be able to support why you're making those recommendations. And that gets back to evidence, and I love to debate stuff like that, and am ready to, and I just think that our education previously has been so narrow that people don't even understand, like, how can I help a cruciate dog with orthotics? Oh, I've been
Mhm.
taught that braces are bad. We have to re-educate uh,
Yeah.
the professionals and the public, out of just things that they've been told, and like, no, here's what the current evidence is showing. These things are valuable. You have soft braces, hard braces, custom braces. There are always so many things to try, and I think the challenge is spreading the word, getting what we can do, what we can offer, into the minds of consumers, because they might just be stuck. Oh, my dog is lame. Okay, you
Mhm.
need a crouch, you need a TPLO. There just has to be this information campaign to let people know they have a lot more options than they've possibly been given.
Yeah, I love that. We have a comment from Ingrid. Thank you, Ingrid. I would love to see the science in journals made more public so consumers can work with their professionals on best practices for their animals. Yes, I agree.
I agree too. And I think that is happening, especially with open access journals like Frontiers. Um, and so I love going to pubmed.gov, and it's US based, but, and putting in search terms. It's like free online shopping. You often get a lot of articles that are free for download. So just doing that can really expand your awareness and empowerment, so that if a client is there, that they can say, well, look, here's this study, here's this one also, to their veterinarian or to whoever it is, and say, this is what I'm interested in. I'd like to give it a try. Do you have anybody you can refer me to?
I might be saying something super controversial here, but I'm going to tell it to you guys anyway. If you go onto PubMed and you do your search and you're not finding anything that's in line with what you're looking for, I have been using ChatGPT to search for research articles. So I'll tell it what I'm trying to figure out. What is it that I'm looking for? And then I'll say, reference, like, find me research articles that look at this, and it comes up with way more than I managed to find when I looked at the journals. And then they're all linked, and I go to the articles. So before I ask ChatGPT to tell me what they say, I go to the articles. I'm like, this is a real article. I check it out, and then I sift through them from there. So give it a try.
That's perfect. Yeah, I haven't delved into ChatGPT yet, but I need to. But I still have a wall there. But when the things that I have seen with AI, in a good way, are, if I can link to the original source, that's where we're using our critical thinking and not just accepting, any hallucination that comes along.
Yes, ChatGPT does lie and does hallucinate. That is true. So make sure that you actually read them for yourself. But in terms of a search engine, I found it really helpful. So there we go. Narda, are you going to be attending the summit? Are you going to be watching the lectures with us?
Absolutely. Just like every year. I just love it.
Okay. Is there something on the lineup that you're really excited about? What are you most looking forward to?
Well, I love anatomy. Just like you, just love anatomy and the link between structure and function. So those types of presentations, they always just, fill my heart.
Yeah. Okay.
Mm-hmm.
I think Jana Gamze's and Ariel's lectures, where they're going to go into the sport and the biomechanics behind the sport, I think that's going to be really very awesome. Ariel's lectures always blow me away.
Oh, so yeah. She's amazing. Right.
And then this is the first time we're having Annalie Sanders lecture for us. I'm very excited. I love her stuff.
Yeah. No, it's top notch.
Yeah. So those are highlights for me. And it's also the first time we have Gillian Higgins lecturing. Again, I'm a huge fan, so I'm very excited about that one. There are two of those. So there's actually, I love our whole lineup. Yeah.
Me too.
Okay. That is Marquetta. Thank you so much for joining us. It's super great to see you. Yeah.
Always good to be here.
Thank you for that. That's it from us today. Guys, I hope you're joining us at the Vet Rehab Summit. Narda is going to be there. CuraCore is going to be there. They're going to have some really awesome stuff to share with you. So you need to be there live if you want to know what's happening. We have a bunch of new stuff at the summit that we're working on. If you have been attending for a couple of years, you'll know that no year is the same as the year before, because we're always finding new ways to bring the companies that support us and the attendees that join us closer. We really believe that that relationship is so important, and new ways to support our attendees. So we've got some really great things up our sleeves for you guys. That's on the 8th of November. Registration is free if you come for the live event. If you want recordings or CPD, if you need CPD points from it, then you need to register, you need to buy a ticket, or you need to become an Online Pet Health member. The whole event is free for Online Pet Health members, plus CPD, plus recordings, plus VIP access, all the extra bonuses that we create. Our members get everything. If you're wondering how to do this in the most cost-effective way possible, it is not the free ticket. It is an Online Pet Health membership. So just putting that out there. Guys, if you have any questions for us, let us know. We're going to be having prelims twice a week for the next 5 weeks. It's going to be really fun. Narda, thank you so much for joining me today. It's been super fun.
Thanks, Anna. Yeah, always a pleasure.
Bye, guys.
Bye-bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.